We took directors from the departments that would be affected, and one other person, a staff member that does the work every day, person that's going to be at work, they're doing that work every day. And we initially went and wanted to look at hospitals that had recently been upgraded to see what was out there, what was working, what didn't work. So we did some hospital tours. We had 5 different facilities. After that, we came back with that information, and each of those 3 departments had asked for volunteers. We took three to 4 more people and made up then the group that would discuss and go through the process of how our work's done now. And that went to very minute details. And then what we looked at, what would we like our work to look like? Also involved in that process was our patient advisory committee. We went to the smallest of details. So we talked about what are they doing when they're lying in bed and what do they look at when they're lying in the bed? Do they have a place to charge their phone? How does it work from a safety point? We had mocked up rooms, we had a bed in there, a table. Could you get the table around? What were the obstacles to giving care to them, and what were their obstacles for being in the hospital? Tried to put ourselves in their place, and then that's where the patient advisory team really came in, because they had a different perspective than ours, and so we combined both of those views to look to see how we could best give care to the patient. The bathroom was an important piece of it, not just about the size necessarily that was important, but the location of the bathroom. There's numerous studies out there that show that if a patient's lying in bed and they can't have a direct view of the bathroom, you have an increase of falls, and then in falls we have an increase of injury to our patients. We spend a good amount of our time walking. They timed us on how much time we spent looking for supplies, how much time we were at the desk, how much time we were in the patient's room. And then we practice walking those things. By doing our work efficiently, you're going to save on the nurse. You're going to save on the nurse's feet. And then we're at the bedside more because we're spending less time going from patients' rooms to get equipment, supplies. It was really, I couldn't say enough about how perfect this project has gone, and I think we're going to have a great outcome just because of who all was involved in getting it to happen.